Over the past couple months, there has been a movement among COVID experts to focus less on test positivity rates for two reasons. One is that the Omicron variant tends to cause less severe disease and more asymptomatic infections that people don't get tested for. The other is that we have no idea to what degree at-home tests mess with all these numbers if they're not getting reported. Well, despite all that, the 14-day rolling average of positivity is showing signs that the Omicron wave may have peaked and is starting to decline in Connecticut. But how reliable is this? One viewer, Alan from Beacon Falls, wrote in today to ask how we can trust this percentage. Well, Alan, if this is all we had, I guess we can't. But we do have other data showing us the same thing. Look at hospitalizations. If we switch here, they're starting to show that same early peak, plateau, and maybe a beginning of a decline as well. To be fair, we've been suspicious of these numbers too, because Omicron can go undetected more often. Therefore, a greater number of these people haven't been sick with COVID. They just happen to test positive after going to the hospital for other reasons. So you know what? Let's look at the people who are at the hospital because they're sick with COVID, the people in intensive care. The change isn't quite as apparent as you can see here, but it's there. After rising almost 50% in under 3 weeks, it stopped rising and it's even dropped modestly in the past few days. So yes, we do have reason to believe that even if the positivity rates aren't exactly accurate, they still seem to be painting the correct picture of where we're headed. So if this was the peak of the Omicron wave, how close did we get to running out of hospital beds? Now, I started this graph here at 60% occupancy because that's usually a good pre-COVID baseline for how full hospitals are at any given time. And as you can see, Connecticut here in the orange compared to the U.S. in the blue, we have been trending higher than the national average, but we never did hit 85% full. And while the national percentage is still rising, ours may be starting to fall. We'll know a lot more this time next week. I'm Tim Lammers, Fox 61 News.